Hi, I am Dr. Surekha Tiwari. I'm a practicing homeopath and a practicing counsellor. I have patients in Bangalore where I have 2 clinics, and I have patients outside Bangalore too. It's been a beautiful journey with homeopathy and psychological counseling. The shoulder cuff has 3 segments: the front, the back, and the top. Underneath, the shoulder is kept free for movement. Now, any of the set of muscles which is in a spasm produces the frozen shoulder, so-called frozen shoulder, where the movement or the range of the movement of the shoulder is actually limited. The first thing to understand for all of us is that when there is a limitation of movement, my first understanding says that there is some muscle which is not kept right, which is some muscle which is not used right. So let's do that part of it. The first thing is pampering, where you massage it, give it a hot water pack or a cold water pack, depending on what suits you, and then keep on giving it regular physiotherapy for movement. Generally, frozen shoulder can happen if you've slept on the wrong shoulder for a very long time. Frozen shoulder often happens when there is a hyperextension into any position. People can overreach and then suddenly they find they can't do it. Frozen shoulder can often result from injury. If you've fallen on the shoulder, so the muscles groups will go into a spasm and not give you any kind of service. And often in a few cases, we also see it because of age. With all these cases, if you can give it a massage and if you can take regular physiotherapy, the shoulder improves for sure. Medicines in homeopathy are many for this. In fact, you would be surprised to know that in homeopathy there are different medicines for right shoulder, left shoulder, because homeopathy believes in the theory of individual. Each individual will have individual symptoms. Depending on those symptoms, the best medicine can be given, and that can produce the best results. So please go ahead and find out a homeopath near you and go through this. Too many x-rays, too many MRIs don't help. Just a simple process of physiotherapy, fomentation, medication, and rest will recover your frozen shoulder.